one last thing I forgot to mention on the slide. Okay, so how do bacteria develop resistance um, against these natural penicillins? Well, bacteria develop resistance by producing an enzyme called penicillinase. Penicillinase enzyme. So that means, for example, Staphylococcus aureus, okay, is a bacteria that produces penicillinase enzyme, which means you cannot use penicillins to treat Staph aureus infections. Okay, in order for us to kill Staph aureus, we need to um, use different class of cell wall synthesis inhibitors called penicillinase resistant penicillins. These are the ones that can kill Staph aureus. That's why the other name for them is anti-staph penicillins. Okay. I want you guys to know that these penicillinase resistant penicillins, also called anti-staph penicillins, are not good to treat MRSA. They are not used to treat MRSA. Not good to treat MRSA. These are the ones that have names like nafcillin, oxacillin, and so on and so forth. Okay. We have broad spectrum antibiotics. Broad spectrum antibiotics. Okay. So these are also known as aminopenicillins. Aminopenicillins. Okay. The advantage of these is that they have a more of a gram-negative activity than the penicillin Gs. Okay, than the penicillin Gs. How can bacteria develop resistance against them? Because bacteria can develop beta-lactamase enzyme. So the extended spectrum penicillins, these include, you guys have probably heard of these. Let's see, very commonly. I'm only going to give you guys names that you guys know and have heard of. Examples include ampicillin and amoxicillin, amoxi. Okay, so these are very popular. Amoxicillin. These are important because they have activity against gram-negative bacteria, especially against gram-negative bacteria that cause healthcare associated infections. Okay, for example, Pseudomonas aeruginosa. It's a very common cause of healthcare associated infections. Okay. Cephalosporins. 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 Okay, so these are bactericidal. Their mechanism of action is they bind to penicillin binding protein. Cephalosporins are grouped into basically 4 generations, and from first generation, second generation, third generation, fourth generation, and the grouping is based on their spectrum of activity. Okay, so let's go over this. The first generation cephalosporins, okay, these are active against gram-positive infections. For example, cephaloxin, which is Keflex. You guys have probably heard of this one. Okay. Um, Second generation cephalosporins, like the cefuroxime, has a broader spectrum. You guys must know a clinical importance of first and second generation cephalosporins. These are very commonly used in the hospital as prophylaxis during surgery to prevent infections. Okay. Third generation cephalosporins. Third generation cephalosporins. These even have a broader spectrum, meaning these can have a spectrum against more gram positives, and even now they cover more gram negatives. These are very good because they are able to penetrate the blood-brain barrier and go to the cerebrospinal fluid, which means that you can use them to treat central nervous system related infections. Okay. Um, let's see. These are all. What do you need to know about